Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Good morning and welcome to Open Your Eyes.
Start your morning right.
I'm Marlene Cuellar.
And I'm Paul Lopez.
And thank you for joining us this morning. Yes, it's a Tuesday morning,
yes.
But I do want to just start off by saying I know yesterday in the newscast, it was a pretty heavy newscast.
It was.
We saw a number of incidents taking place, from fatal traffic accidents to the double murder in the West as well. And I know you were on the scene of the accident yesterday. So how are you doing?
Well, you know, it was a pretty heavy weekend. And we jumped into the day yesterday as we normally would.
Yeah.
As reporters. I reported to work on Monday and set out our assignments. I was following the double homicide in San Ignacio, such a tragic incident. A 12-year-old lost her life along with her mother. And we were on the way back. It was raining. It was a rainy afternoon. We met some heavy rains along the highway heading into Belize City. I was busy working on my assignment because I work on the go on my laptop, and I had my headphones on. I have these huge headphones, and you rarely hear anything out of them once you're in the zone. And momentarily I take a look up, and when I take a look up, I think it's because my driver, cameraman George kind of prompted Paul. And so I take a look up, and the image keeps flashing in front of my mind of this small white vehicle being dragged along the highway. At this time, I'm not certain who all is in the vehicle. I just know that this is going to result in some tragedy. Our first response was to preserve our lives, because you have to understand that we were caught in between two trucks. One truck in front of us and a second truck behind us. The larger truck behind us, smaller truck nonetheless. And we had to maneuver our way out of that situation. Kudos to George for being calm and brave.
Which isn't easy, yeah.
Which isn't easy. And so he found a way to get us out of that without any sort of damage to ourselves.
Yeah.
And I sat there for a couple of seconds, and I took a breath. I was like, all right, we're okay. But instantly my mind clicked. There's something happening behind us. There may be passengers in that vehicle. So we were the first to be on the scene because of how we were positioned in traffic. And I ran. I just ran to the vehicle. I didn't know what I would expect. And you know, people often say, you go to an accident and you're not sure what you expect.
Yeah.
I understand that.
Yeah.
I didn't know what to expect. And the first thing I saw, which was tragic, this mother holding her child, a 10-month-old child, and the story tells it all. The story says, the mother says, my baby dead. For me, the most heart-wrenching part was watching this mother hold her child and not wanting to let go, even though she knew the results. She knew it was the end for her child's life. She just kept holding on to the child. It's as if she had this small hope that my child will awake from this and that this is a dream. Another lady came by. I don't know her, but she's the second to arrive, and she ran. And this time, the mother was leaning to the rails on the street, holding the child, and the mother began feeling weak, began, saying, "I feel like I'm going to pass out," but she didn't want to let go of the child. The next lady, who obviously appeared to be a mother, told the woman, said, "I'll take the child." This bleeding child, this woman in a nice, pretty green dress, she didn't care that her dress would get messy with all this blood from the child. She just took the child, and in that moment, I threw what some would say is professionalism out the door, because the mother was about to collapse on the ground. And we're taught in some cases that when you arrive on a scene, or that when you're conducting your interviews or covering a story, that you're not to engage the interviewee in an intimate or physical manner. I threw that out the door, because for me, this woman was falling. This woman was passing out. Her child is dead. There's another passenger dead. And what was important was that we kept this woman alive. I'm no medic, but I figured that what I could do is to help to calm her down. What I could do is to help to ensure that her heart rate remains at a steady level while we wait for medics. So she fell to the ground. Well, we eased her to the ground. She sat down, and I knelt behind her as this back brace, because the ground was messy with oil and water, and we didn't want her on the ground. And we weren't sure what was the extent of her damages. She was just complaining of stuff in her leg. And we basically, me as a back brace, the other woman just holding the child. We were there for about 20 minutes. It was a hard 20 minutes. It was a difficult 20 minutes, a tearful 20 minutes. And then finally, police began to arrive. More people began to arrive, and then the ambulance arrived. The ambulance declared, the medical persons, they declared the child dead, and they declared the other passenger dead. When they told the mother, "Your child didn't make it," she said, "I know." And I looked at her like, yeah. But that entire 20 minutes she was preparing. It seems as if we were there to help her understand that your child is dead, but you're alive. She asked, "Why did I live? Why was I the one who lived?" And honestly, we didn't have an answer for her, and we told her, "We don't have an answer for you, but we hope that with time we'll get the answer to that question." And so finally, when medics arrived, we were able to leave and get back to the work. I honestly didn't want to touch this story, to be honest, but I had a job to do, and so we produced a piece last night, just showing exactly, what transpired.
Yeah. And she was the driver.
She was the driver, and so she survived as the driver.
Yeah. I mean, I hear it's very heavy to have been in that particular situation, and there is most likely a reason why you were there to be able to assist at that time. I hear you talk about putting aside the expected behavior of a reporter on the scene, but I think I told you as soon as I walked in this morning, we're human first.
Right.
And anything else that takes place, that's the first response. It's heartbreaking to hear the story. I saw your recount last night of this lady holding her baby who was lost in the accident, and I think across the country we all feel the sense of sadness, especially coupled with the other news coming out from the weekend. It's a lot. Children dying, mothers dying. I know the other traffic accident victim is a school warden as well, so that means there are a lot of children who know her. And it is a really, really sad morning, I think, for all of us. And it's good that you're able to talk about this. This is very important because it does have an effect on you.
No, I mean, it does. You know, in the rush of things, and you'll probably get a sneak peek into what a reporter's life is like, or what his mind is going through. But in the thick of things, you don't get time to really sit down and process it. I think it really hit me what I went through, or what we all experienced collectively, those that were on the scene, after I left the office and I had time alone. I drove up to Ladyville last night to a family function, and during that drive it hit me.
Yeah.
You know, but I was glad that I was okay enough to get in a vehicle nonetheless. Say a little prayer. I think the key message here is road safety.
Well, yeah, and I honestly want to call it what it is. It's reckless driving.
It is.
It is reckless
It is.
driving. And, you know, we drove to Belmopan on Saturday for the Children's Parliament. And, you know, it's one of those things that I think anybody who travels on the highway knows, sees, and experience all the time. There are people who have absolutely no sense of responsibility when they get behind the wheel. The accident, as you explained it, is a dump truck that was trying to overtake and didn't see oncoming traffic.
Yeah, so it's definitely reckless driving. The truck that was in front of us, the driver of that truck, because of how elevated his seating was, he would have, and he was in front of us, he would have seen everything. I recall him jumping out of the truck in an angry rage towards the next truck driver that's going in that direction, just hurling bad words. But he was basically saying, "You're reckless. You should have paid keener attention to what was happening."
So he attempted to overtake.
He attempted to overtake, and in the process, he realized that he was unable to, because 3 vehicles were coming in the opposite lane: a dump truck, us, and a third truck, and a third truck behind us. And so he attempted to swerve back into his lane.
And that's when he clipped the car.
And that's when he clipped the car. Now, the thing is, when he clipped the car, the car didn't appear to sustain a lot of damage. It was just dragging along.
So it spinned in front of the truck.
Right. The brunt of the impact was when that car propelled into the front of the second truck. And so after sliding on the road in front of that vehicle, in front of that truck for some time, it let loose from that truck, and it just slid and slid onto this other lane, and it slammed into the tow head. And that's where the brunt of the impact was sustained, while the passenger and the child was sitting in the front seat, and they both died upon impact. I mean, that impact was so heavy. There's no way they could have survived that. So indeed, it's reckless driving.
Yeah.
I mean, we're talking about, we're on a stretch, we're on a straight, we're on a straight, and the straight goes for at least 3/4 of a mile, and you're in the middle of this stretch. There's no way you could tell me that if you're paying keen attention, you can't see that huge trucks are coming and that there is no chance for overtaking at this time. But I believe in an attempt to test, how well you're gauging the distance. I think that's why the driver perhaps may have made an attempt and then realized too late that it was too much.
And there was another fatal accident over the weekend as well. So we know the police has issued a reminder to people to be more careful. But I think it shouldn't take a reminder. And that's what I'm saying. You know, we can speculate as to what the thought process was, but fundamentally it's reckless driving.
It is.
Because we need to be able to think of others and what can potentially go wrong when we're on the road. And we've seen so many people just not care. They're just speeding to their destination, and that seems to be what's most important. And so just, you know, I knew coming in this morning that this was going to be a heavy morning for you. So I appreciate you sharing your perspective there. And I know you also went out to San Ignacio to look at the double homicide that took place there. Another really, I know nobody wants to start their morning like this. It feels really heavy. It feels heavy here too. But this is the reality of what's being experienced. But I think important is helping to find the little boy. So looking at that story, the murder of a mother and her 7-year-old, or 12-year-old, sorry, child.
Yeah, the man accused, he we were told that he fled on a motorbike belonging to his employer. The family believes that he may already be across the border. There are reports, unconfirmed at this time, that he may have been caught.
Yeah.
And
Yeah, we
so
haven't been able to confirm
we
it
haven't
as
been
yet,
able to confirm that, and we haven't been able to confirm the whereabouts of the child as well. And so those are updates we're following.
Yeah, so definitely quite a bit to digest as of yesterday. And so, as I said, I think, you know, everybody woke up this morning just feeling a bit sad over those stories in itself. And thank you for still providing the report and sharing your story this morning. I guess the good news is looking at our Beauty Queen and the music, the musical artists who were able to sign on to contracts. So there was some positivity, at least, to reflect on at the end of the weekend. But we got to get moving into our show for today. And after having those very tough conversations, we're hoping that our eye-opener this morning will shift your mood to help you feel a bit more motivated. So our eye-opener for this morning, taken from dailyom.com, goes like this. Expressing ourselves honestly in any relationship is essential to our well-being. When we are in a relationship where we feel listened to and understood, we count ourselves lucky because we know how rare that experience is. We reserve our most intimate selves for the people who, along with us, co-create an open space where we feel free to express ourselves and listen without judgment. These relationships, which thrive on open communication, can mean the difference between existential loneliness and a deep sense of belonging. We all long to feel heard, understood, and loved, and clear communication makes this possible. We can also meditate on our own time and then practice what we need to say. A visualization in which we sit with the person and lovingly exchange a few words can also be a great precedent to an actual conversation. If writing comes easily, we can write out what we need to say. It may take several drafts, but we will eventually find the words. The key is to find ways to center ourselves so that we communicate meaningfully, lovingly, and wisely. In this way, we honor our companions and create relationships in which there is a genuine sense of understanding and respect.
It's good. I love that. I spent some time with a mentor earlier this year, and we spent a lot of time talking about relationships. And he has 2 commandments when it comes to relationship: commitment and communication. The 2 C's. And he often reminded me that communication is the most important of the 2, and that everything rises and falls on communication, encouraging me that in all relationships to spend time talking, speak about how you feel, share those hard feelings, those hard thoughts, those hard positions, because that is how you basically communicate your position and also hear and get to know others as well.
I love the eye-opener when it says something about, when it points out about being heard.
Yeah.
You see, the thing is, there's listening, hearing the words that people say, and then there's hearing someone. understanding what they're truly trying to communicate to you. And that takes a lot of practice. It takes a lot of open mind. There's nothing worse, I think, or more lonely when you feel like you're not being heard
Right.
by people that you love. And it can happen in families, it can happen with spouses, it can happen in work environments, it can happen in many different spaces. And, you know, just because you say it doesn't mean that it's actually internalized by anyone else. So I think it's so key how the eye opener kind of gives you some tips.
Yeah.
If communicating your thoughts or feelings it's difficult, practice. And it sounds weird. I've done it. You know, if I have a tough conversation, sometimes I'll do a practice session. Whether it's with yourself, with others, it's great to be able to ensure that you can communicate exactly what you think.
You practice in front of the mirror?
Yeah, I can, or with other people. I have great sounding boards, you know, just I think it's, you know, we are in the business of communicating,
Right.
and we know that what I think I want to say, what I actually say, and how it's received can all be very different. So it is important that you're able to do your best in putting out the information with the hopes of it being received in the right way,
You know,
in the way that you intend.
I know that there are people who don't necessarily can't find the words verbally, but they know how to express themselves through poetry.
Yeah.
They know how to express themselves through journaling.
Yeah.
They know how to communicate through storytelling. And I've seen it done before. So I think one of the things the eye opener highlights is that find
Yeah.
how you communicate.
Yeah.
Because like you rightfully mentioned, the hardest thing is to feel like you have no one to listen, or as if you're not being heard.
Yeah. All right. Well, I hear you there, and now it's time for us to hear about the weather. We have forecaster Derek Redun on the line to tell us about what we can expect today. Good morning.
Good morning.
How are you
Good
today?
morning.
I'm doing good, thank you.
All right. Well, tell us, what can we expect in our weather?
Okay, today we can expect mainly fair weather. We can expect mild temperatures today with little or no rainfall. And tonight, partly cloudy and cool with isolated showers, but mainly offshore.
And what about the winds? Feels a bit
Okay,
chilly.
All right, there's a weak cold front that crossed the country earlier this morning.
Oh.
And that is why it's a little cooler than yesterday. So the winds will be from the north to northwest at 10 to 20 knots, and seas will be moderate.
All right. And those high temperatures?
Okay, not so high today. 82 along the coast, 86 inland, 72 up in the hills. For tonight, 70 along the coast, 65 inland, and 59 up in the hills.
Okay. And will we be seeing much of the same for the next few days?
Well, for tomorrow, the winds will go around. We can expect northeasterly winds and a few light showers over the north on Wednesday, and then mainly along the coast Wednesday night. But by Thursday, it gets back mainly fair to isolated showers.
All right. And I feel like I want to knock on wood before I ask this question. We're entering into the last week of the hurricane season. Anything we
That's
need to
right.
be monitoring?
Yeah, we don't foresee anything developing over the next few days.
All right.
So tropical cyclone formation, not expected.
All right. Well, thank you very much for that update.
You're welcome.
You have a great day today. Stay safe.
Bye-bye.
All right.
Some good news. I did feel a bit of chill this morning. I wasn't sure that the cold front was passing over.
Yeah.
It was short-lived. I'm sad about that.
Well, we're moving into that season. so-
Yeah, indeed.
All right, but we got to get moving into our show. And this morning, we are going to start our conversation. Last night's story, I believe, in looking at the double murder is highlighting something really important. And we're about to start off with the 16 days of activism. Now, one of the key days being commemorated is taking a look at gender-based violence and what we're doing, what we have been doing, and what we need to do. So today we're going to have a conversation with a representative of Spotlight Initiative and the National Women's Commission to talk about how these days of activism are going to be commemorated, and more importantly, what is there to offer people who want to escape from a situation where they're experiencing gender-based violence.
And in our second conversation, we have Galen University, who will be joining us via Zoom, and they're introducing a Master's in Development Studies program. And so we'll have Galen representatives telling us all about this new program. You do want to stick around and find out about that.
All right, and the last part of our show, Bellifa, the Insurance Association, is going to be joining us to tell us about their latest fundraiser. Now, they have had an established relationship with the Kidney Association of Belize for a long time. They used to depend on their Red Gala to be able to raise funds to help patients who had chronic kidney disease. And so we're going to find out how they're trying to raise the money. Clearly, with COVID, you can't be able to have any dress-up gala at the end of the year. So we'll find out how you can support in the final part of the show.
Right. Well, with that, we'll take a break. And when we come back, we'll have discussion surrounding the 16 days of activism. So stay tuned. We'll be right back.
We have been a partner with SMART for over 10 plus years. We have a full SMART plan we use as our major driver for our business. We have a service that rolls over in that if you call one and it is busy, it rolls over to the next line. So once you call us, you can get us at any time. Before we got this SMART service, we were paying upwards of nearly $2,000 in phone bills. Since we've had our SMART service, we pay an average of about $600. So we've had tremendous saving, more than 50%. For the businesses, if you want to save money, switch to SMART because it is far more cost effective and the service is excellent.
SMART continues to be innovative in bringing new technology and meaningful savings during these challenging times to businesses across Belize. Sign up for our VoIP technology or broadband packages and save more.
The Belize Bank, our country, your bank.
The TV you love is always with you, from live TV, sports, and on-demand titles. Choose your plan today. Plans start as low as $15 per month. My TV, entertainment, anytime, anywhere.
All right, and we're back. And as we promised, we have joining us via Zoom two wonderful young ladies. We have Ms. Tia Garcia Ramirez, the president of the National Women's Commission, and we have Perla Hinojosa. I practiced that name all throughout the break and I still didn't get it. And she's the communication officer there at the Spotlight Initiative. Good morning, ladies.
Hi, good morning.
All right, well, thank you both for joining us. We're here to talk all things 16 days of activism and the activities planned for the recognition of these days. Let's start perhaps by getting opening statements from both of you ladies as to where we are currently in our awareness and activism against gender-based violence. Starting with Thea.
Hi. Well, good morning to you both. Where we're at is not so good. It seems that every year, as soon as we are going to start or we have started the 16 days of activism against gender-based violence, I don't know if it's coincidence that we start to have all the violence on the news, especially against women and now against women, children as well. I know last year we were at the same place and here we are again this year. It is most unfortunate, but it highlights the need for the education that we do all year round. It also it marks the importance of the advocacy, the education, like I said, and that we're working with all the stakeholders and partners. The UN team certainly partners all year long with us, and we're grateful to them and grateful for that. But it just highlights how much more work there is to be done, how much we have to continue on this track and ramp it up. And as our theme says, it's not only for 16 days, but beyond 16 days and 365 days a year, that we need to keep our foot on the gas and make sure that it stays at the forefront, on the front burner, to say that violence is not acceptable in any way, shape, or form, but it is even worse when it is directed against women and women children. We have seen on the news, I think this week it was 2 different incidents the past week, one of them involving a 12-year-old girl. I cannot even express how saddened I am that these things continuously happen. I know a few months ago it was a gentleman who hit out against even his mother-in-law, who was an elderly lady, and it just highlights the need for us to keep on advocating, educating, and putting programs together for not only for women but also for men, and trying to stem the tide by trying to educate men on how to just really don't hit women. So we're trying to also work from that end, not only work with the cases that are already happening, but to stem the tide and to stop them from happening. And so that's the real issue. That's what we highlight on the 16 days, starting on the 25th. So it will be on Thursday, and it's all the way to the 10th of December. And it is this way because internationally it starts and encompasses human rights. Women's rights are part of human rights, and it ties in with World AIDS Day, and it ends on World Human Rights Day on the 10th of December.
Now, it's interesting to move into the 16 days of activism, and you're right. One of the most tragic things that we see almost every year is that we see some of the major incidents always happen around this time, perhaps tied with the economic situation, the lead into Christmas. I'm not sure, and I think that's a key point to bring Perla in, because the Spotlight Initiative has actually ventured into putting together data. I know you discussed your baseline survey that was conducted trying to get a better understanding of the situation of gender-based violence. How does that information feed into the 16 days of activism coming up?
Thank you, Melanie. And first of all, I'd like to say thank you for having us here. And I'm here representing the wider UN country team to highlight the campaign and the localized events, which many we are supporting the National Women's Commission on. And yes, recently we did launch our baseline study where we had 1,253 people surveyed, and out of that, 11.2% of them thought it was justifiable to hit their wife or intimate partner. And you can see that violence against women and girls continues to be the most pervasive and pressing human rights issue in the world today, not only in Belize. And it impedes equality, development, and peace across the world. And so when you engage the wider communities, the CSOs, men and boys, and the people who, need to get reached for this to advocate and for them to get services and information, then you are changing those gender norms, those things that exist, and trying to eliminate violence against women and girls in the communities. And yes, through the Spotlight Initiative, which is a program that is with the United Nations and the EU, with a tight collaboration with the government of Belize and CSOs and partners, we are trying to reach the most vulnerable and leave no one behind. But as a whole, the UN in itself, it's part of its 2030 agenda. And we do have fully integrated into our programs, not just Spotlight Initiative, gender equality. So that's something that we look at as a whole UN.
Yeah.
Perla, I think you mentioned that 11 out of how many men? 30 something?
11%.
Oh, 11%.
Yeah.
11.2% out of 1,253 surveyed individuals. And these were individuals from all over the country, different ethnicities, rural and urban areas. And so you can tell by that even though it seems, 11.2%, not a big number, it is still
in fact, that's
big.
over 100 men out of the...
Well, men and women mixed.
Men and women. Let me just ask you, where does that behavior come from? Because I won't pretend to know why a man or a woman feels like it's okay to hit their significant other. Where does that behavior and that mindset come from? Where is it developed?
So from the home.
Yeah.
I believe from the home.
Yes.
It's traditions and norms and culture and inherent biases that we pick up from our socialization, from our communities. There is traditionally, that's what we're taught, that it's, if a woman steps out of line, it's okay to slap around a little bit, push her. We think nothing about emotional violence, about financial violence. A lot of women, a lot of men do not even recognize violence other than physical violence and hitting, but violence against women can also mean financial violence, withholding of financial resources. It can mean emotional, it can mean verbal abuse. And some people will tell you, oh, well, he's not hitting me, but he is being violent in all the other ways, and so they don't recognize it as abuse. So the reason we don't do that is because it is in many instances socially acceptable to be violent against women, and I'm not saying just physical. It is okay to withhold financial resources from your wife, especially if she's not working. People think nothing of saying, well, you don't need all that money. I'm going to leave you $2, and then when you come back home, they want the bill and the receipt for the $2. You're not allowed to leave the house. You're not allowed to have a phone, use the phone how you want. All these things are abuse, and we don't recognize it because we have been socially conditioned not to. And we have been socially conditioned not to by our families, by our parents, and sadly, by our mothers, because the cycle of abuse, it is a cycle. And so it goes from one generation to the next, and we have to stop it, and we have to break that cycle.
Yeah, the moment you see it as normal, as in it happened with your parents, you're more likely to accept it within your own personal relationship. I wanna press on something that I know will probably be said over the course of the next 3 weeks. Usually when the 16 days of activism comes up, people start saying, oh, this is the only time that these agencies work. This is when they're doing all these activities. How do you put it into perspective why these days are designated to be able to bring these issues to the forefront? Taya, you want to take that?
Well, okay. Well, this is when we ramp it up, and because we always think about 16 days as sort of highlighting, and it ties in, like I said, to the wider inherent rights that we have as humans to live and work and be in peace, and live in peace, and live and have the same rights as anybody else. So we tie that in there, and yes, we ramp it up 16 days, but we also have a whole month long in March that is Women's Month, that we also do a lot of work with. I think the Women's Commission in particular this last year has been very active. I won't speak to 2020 because obviously, because of the pandemic, it was very hard to do anything, and we were on lockdown a few months. But particularly this last year, 2021, we have done a lot of work in training. We have engaged with many of the frontline workers for gender-based violence and domestic violence. We have worked very closely with the police. We have worked very closely with health workers, with the Women's Department, with the social services. We have worked particularly well with all the UN group, with Spotlight, who is one of our major partners, and who will again be partnering with us. I think this is when we highlight to the public, but our work is year-round. We have done a lot of work with the gender-based violence pathway. We have done a lot of work with creating gender advocates, especially in the rural areas where these social norms, where it is okay to hit women, and traditionally and culturally that is accepted. We have a whole group of gender advocates that will help you and lead women and lead you to the services that you would need. And so we have done a lot of work. We work with ESCLAN, for instance, partnering with ESCLAN, and what they do there is they train young men to work with other young men to raise awareness and education. A lot of people, because like I said, it's a social construct, and the way we are socialized, may not realize that what they're doing is wrong. And so, they talk to young men, especially in the vulnerable areas, and say this is not okay, and explain why it's not okay. And it might seem very, very simple that we should know, but a lot of us, the way we were raised, don't know. And so we have to be taught, and we have to be mentored, and we have to be, we just have to socialize our young men a different way. And so all year round, we have done a lot of work. All the partners have done a lot of work. And this 16 days is just stepping it up and highlighting it, because a lot of times we forget that women are people too, and we act as if we're a different species and should be treated differently. Rights, like I said, are inherent. Nobody can give us any rights. Our rights as women should be recognized and should be respected. Absolutely. Because no one can take away a right, and no one can give a right. So that's what we seek to highlight. I know that there is a lot of criticism, and they say, "Oh, well, they just remember about women." No, we remember about women all year round, and we work towards creating opportunities for women. We work towards highlighting where we need more resources, and that is the job of the Women's Commission. We are an advocacy and policy unit, and we advise the minister and the ministry on all these issues. And particularly, we advocate where we see a need, where we see, for example, we have the complaints mechanism.
Yeah.
And so when services are not being rendered in an efficient and effective and fair manner, you can go and you can make a complaint, and we follow up and we try to improve upon the services. And we have done a lot of work with the gender policy this year. And so we have worked really all year round.
Yeah.
And we have been on the show before.
Yeah,
so.
I'm glad we got a chance to get ahead of that one, because I think we've seen it be said every single year. But it does. You said something important, that it gives you an opportunity to kind of put Perla, the spotlight on the ongoing initiatives and the advocacy for work that needs to be done. I want to tie in yesterday's events just a bit, where we saw the police being asked about prior complaints made regarding domestic abuse. This is the double homicide in San Ignacio. And I think that's a key thing that we hear every time a woman is murdered by her intimate partner. It shows that, I mean, we know several things. I'm sure you know from experience, from your surveys, that not every case of domestic abuse or violence within the home, emotional, verbal, physical, sexual, not every case is reported. Yet that still is something that we struggle with getting women to be able to do. What are your thoughts on perhaps legislative changes that have to be made, things that will make it a situation where women don't have to look at how many complaints were made before they can get action done that would save their lives?
Sure. I believe that Belize does have the legislative structure, and this was also something that was surveyed in our baseline study. So we do have good laws and policies. It's just something that needs to be enforced. And with the Spotlight Initiative, one of our outcomes is law and policy. And this year, we've been able to have 10 consultations to generate recommendations for strengthening family violence legislation. And we've been able to reach 320 survivors of gender-based violence, and 120 stakeholders and 30 communities. We've also been able to have a joint sexual violence prevention and response program. And this includes all the security forces, including the police, Belize Defense Force, and Belize Coast Guard. And they've reviewed and endorsed this at the highest level, and they have seen an increase in reporting, especially with sexual violence. And the other outcomes of the initiative include institutions, prevention, services, data, and helping women's movement through CSOs. And so we have had those outcomes coming out of this year. And a lot of this is with the tight partnership that we have with the government and with CSOs and other stakeholders. And it's really good that we are able to get this program done with the United Nations agencies and the European Union. So just wanted to highlight some of the things that have been done in the law and policy area through the Spotlight Initiative.
The kind of culture change, and this, let me be clear, I think across the globe, this is a difficult issue to grapple with, because you're talking about people within their own private, intimate spaces, decisions made, actions made, and then somehow getting it recognized in a formal system. One of the underlying needs that the country has had for a while is looking at safe havens In other words, if someone needs to flee a situation, there are some homes available that would be able to take them in the middle of the night with their children and provide care and safety for them. But are there enough? And is this perhaps one of the needs identified that would help to reduce the number of people who stay in these violent relationships?
Can I speak to
Yes.
that, Marlene?
Jump in.
First of all, we have to recognize that there is underreporting, and the way the data is collected is also a bit of a problem, and we're trying to sort that out with the different stakeholders. For example, if you were a victim of gender-based violence and you would seek the help of the police, so that is then recorded, and you would see that data in the crime observatory and from the police. But if you choose not to go to the police station and you only access healthcare, for instance, that would not be counted towards an incident of domestic violence or gender-based violence. If you did neither of those things and you just accessed care through the women's department or the social services or the human services departments or ministry, because you need maybe psychosocial help, you needed food or pantry or that or a place to stay, then that would not be counted either. So we need to be more details, and we need to come together and put all the pieces and put all the data together to get a clearer picture. And that's not even saying, as you said, that many cases are still not being reported. Yeah. So there needs to be, we need to be clearer, and we need to make sure that we're putting all the pieces together of the puzzle to get a clearer picture. That being said, I want to highlight that there are homes. There are homes. What is happening is that the people don't, maybe we need more work in trying to get people to know that there is help there. You can access the help. I know of one home, for instance, that has been empty for the last 3 months, and are ready to take in families and help them on the way to recovery. But people that need the assistance are not getting it or are not reaching out. They have to be clear as well. And it pains me really to see that whenever we have reports of rape, reports of even young girls running away from home or disappearing from their home, it pains me to see the comments on social media. And this is where I would want to highlight that, yes, it is a social construct. It is the way we think. It is our own biases or personal biases. A lot of times, people that work take these to work. So you will hear, oh, she looked for it. Oh, but you know what? She like behave bad, so her husband need to put her in a place once in a while. And you see the comments. And it takes a woman, sometimes it's recorded between as many as 8 to 9 times of leaving a violent situation before she finally leaves. A lot of these women, as we can clearly see from this week, do not make it out in time. And so I want to appeal to the Belizean public for some empathy. If we can't even manage empathy, well, at least some sympathy towards somebody else's plight, because when we lose that, we lose part of our humanity.
You know,
that's what differs us from other beings. If we cannot empathize, if we cannot put ourselves in the shoes of these women, a lot of these women have been made to feel that they have no other choice. You have to understand that abuse is about control, not necessarily about sex or anything else. It is about control. They have been systematically broken down to believe that they are unworthy, that they are worth nothing, that nobody will help them. And a lot of the times they have been isolated from family and from friends, and that feeds into their belief that they will not get any help and they are not worthy of being helped. And so I will appeal again at the beginning, at the start, on the eve of 16 days, for us to be very careful with our words and how we approach these situations, because that is what is most hurtful.
Yeah.
When a young girl runs away from home, we don't know why they run away from home.
You don't know what circumstances they're running away from.
Exactly. And they might also be able to read all that people post on social media, making it even more difficult to come back home, making it even more difficult to seek help. And so we have to remember that these are people as well, that women are people, and we have feelings, and everybody has Facebook, not just the people posting. There's a lot of people reading, and this is what fuels that fire, and it's a vicious circle, and it is not good. It really demoralizes somebody even further that is having problems and is reading this thing, and it is so not acceptable. I would ask that the media houses just discontinue the comments. I mean, block the comments, and if you have to report it, but don't let people comment, because clearly it dehumanizes people and demoralizes people even further. It is really, really terrible.
Allow me to jump in a bit. There is this show on Netflix called The Maid. It's a limited series. I'm not sure if you guys have seen it as yet. This is a really good show, and it highlights the issue in this limited series, the issue of domestic violence. One of the issues it highlights is the challenge that women face in leaving. We see in this series certain women going through this cycle of seeking refuge and going back, seeking refuge and going back. I think one of the actors said that, of course, within the context of the story, that this is her fifth or sixth time going into the safe haven after going back into that situation. We see these situations in our communities. We know that and it's easy to judge, to say, well, why you would stay in that situation?
It's easier to judge than to help. That is true. It's easier to judge than to lend a helping hand. And say,
Well, the question, I simply wanted to ask, and you basically kind of answered it, but how many, based on research, how many persons said, you know what, it's hard for me to leave? And what were the reasons given?
Well, in our survey, we did not, look extensively into that, but there is, gaps in the trust that exists in accessing services, and, the knowledge of services that people may have, which is something that we are trying to address. Apart from that, as the wider UN, we do have the principle of leaving no one behind, so reaching the most vulnerable, but also doing no harm. And so sometimes, as Ms. Taya was mentioning, sometimes the comments and the added criticism that comes sometimes does more harm than good. And so it's really important for us to have a survivor-centered approach, ensuring that we all have a part to play in this. And I think the national theme this year for 16 Days of Activism really highlights that it's on me, it's you and me, 365 days a year to end violence against women. Now, I mean, it takes all of us. It takes a neighbor being compassionate or calling the police when they hear something going on, even if it's a couple of times. It takes a police officer making sure that they collect as much information as possible, and have that survivor-centered approach. It takes a family member being there for the person. There's a lot of it's all of us in this together, not only the programs that we have and the agencies that do a lot of this work, but it's on all of us, really.
I'm so glad you said that, because that's really one of the questions I wanted to get at. I hear your reflections on things that people say and the perceptions that the general public tends to have in situations like these. And very often we look out and we say, well, what's Women's Department doing? What's Women's Commission doing? What's the UN system doing? And rightly, there are people who hold responsibilities to take action in these circumstances, but we also have a role to play. And that's I guess, what you're trying to encapsulate in your theme, that if we try to separate ourselves from what we're seeing, we're not helping the problem.
That's right. I'm glad that you showed on your screen again evidence that we have been working very hard. We have developed the resource packet. I would like to highlight that the resource packet was made, and the layout and design of that packet that we have distributed was done by 5 or 6 young women at the tertiary sixth form level. Young girls from the Corozal Junior College, my alma mater, and from the St. John's Junior College. And so, in addition, they have become engaged and have themselves become advocates against gender-based violence. And so, whatever we do and however we do it, we are trying to bring in the younger people. And like you said, in the package, there exists a lot of ways that you can advocate, that you can become involved. Even if you're a faith-based organization, there are 16 points there on how the media can become engaged, and how individuals, or even within a work setting and office setting, can become engaged and be partners against against gender-based violence. And so we every day, all day, and I like what you said, Marlene, that a lot of times we say, okay, but that's not my problem.
Yeah.
But it is, because it is a societal problem. When women are not safe in their own homes, when women are not safe within their own family, it affects a community and it affects a nation, an entire nation. When you empower women, women have the ability to break the cycle of poverty within one generation, because an empowered woman will make sure her children are better fed, are better cared for, are better educated. And so we have the opportunity and we have the power to break the cycle of poverty. So when you have women are about half of Belizeans living in Belize. So it's a demographic is huge. When we are not happy and we're not safe and we cannot work and live within our own country, in our own communities, and we are unsafe, that means we're not as productive. An empowered woman has the ability to produce for her family, for her community, for her country. And so it is, if you want to, for lack of a better way to say it, it's good business to empower women, to make sure that women are safe and are healthy and are happy in Belize, because we have the ability to increase GDP. If you want to look at it from that economic and fiscal perspective.
And they're the ones who oftentimes manage, depending on the situation that they're in, managing the household.
Yeah.
But let's, we're running out of time so quickly, and I know we're going to have much more opportunities to talk about this, but let's find out about some of the activities that the wider public can engage in within the next 16 days of activism. I know November 25th is Orange Day, so we can start with that, and any other highlights.
Well, this year we're choosing the National Women's Commission. What it does, it brings together all the partners. It produces a calendar, which we will send out to the media and to all our partners today, and highlighting all the activities, those that are countrywide and those that are at the district level. We have well over 100 activities planned during the 16 days with different partners, and partners getting together and on their own doing activities and events. Some of those are advocacy. Some of them are actually house to house distributing of information, because that's where we have a lot of gaps. I believe that there are services available, but people just don't know about them. We have not done a good enough job, I believe, of making sure that women, especially those that might be in need, know who to access and where to get information and get help. And so several of our partners have engaged and have taken on that task. We also have our gender-based violence committees, district committees that are partnering and trying to coordinate at the district level. But on the 25th, we have our launch at the Biltmore, and followed by a forum of women leaders. And what we're seeking to do is a convergence of women that are at the decision-making level that can impact change for the better, and help the sisters or the other Belizean women, and to eradicate gender-based violence and to improve conditions for women in the country. And so that is happening on the 25th. Yeah. And then we are, this is one of the biggest events that the Women's Commission is sponsoring. And of course, we are also joined in this initiative by our friends over at the UN, and I'm sure I will see Perla there on the 25th. And also we are closing off on December 10th. And this is on a better note, and we're partnering with the ministry and of course with Minister, the Honorable Dolores Valderramos Garcia, at an Indigenous Women's Forum in Sand Creek. Because we still have COVID, both these forums are by invitation only, but they will be streamed live so that other people can join in. Nice. And already we have generated a lot of interest. The Indigenous Women's Forum seeks to capture the attention and capture and engage women. Women are already severely disadvantaged sometimes, but the Indigenous woman even more so. The women in the rural areas even more so. And so that's on December 10th. That's 10th, going to be the close of 16 days of activism. Yes. The minister wanted to close off on a note of empowerment, yes, on a note of trying to reach these women and trying to provide for them information and service. She places a great deal of importance on mental health and wellness. Yeah. And so there will be that component as well in Sand Creek. All right. And the activities, we will be sure to share with our viewers so that they can know exactly what's happening in their individual area.
I did want to add one event which we are also collaborating with the National Women's Commission on is this Friday. We're having a remembrance vigil from 5 to 6:30 p.m. and this will be live streamed virtually, and so people can join all across the country online and light a candle in remembrance of those people affected by gender-based violence. And I think we will also be lighting the National Assembly orange, yes, as a sign of solidarity. And so everyone is invited to join for that too, and right, details will follow with the media.
All right. Well, ladies, we appreciate just having this very short conversation on this huge issue, and we look forward to be able to discussing it more. We wish you the best of luck. Stay safe.
Thank you very much.
All right. Well, with that, we'll take a break. And when we come back, we'll be joined by Galen University. We'll be talking, of course, about their Masters in Development Studies program. So stay tuned and look forward to that conversation.
Working off-site doesn't mean you have to be off your game. Studies have shown that simply adding a keyboard and mouse to your laptop increases productivity by 26%. Add a monitor and you'll be 35% more productive. At Fulltech Systems, we have what you need to enhance your remote work or e-learning experience. With devices such as headsets, video conferencing monitors, webcams, keyboards, mice, docking stations, all with the brands you trust. Keep connected with collaboration tools like Microsoft 365 Suite and Kaspersky and perform efficiently no matter where you are. Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
The region of the Americas has a proud legacy of being a global leader when it comes to vaccination. Ours was the first region to eliminate smallpox, polio, rubella, congenital rubella syndrome, and measles. We also eliminated neonatal tetanus. Now, more than ever, vaccines play a vital role in keeping us healthy. As we move forward with vaccinating against COVID-19, let us not forget the importance of our routine immunizations to keep us protected against other diseases. Talk to your healthcare provider today to make sure you and your family are up to date with all your vaccines.
Vaccines bring us closer.
Bundle the fastest, most reliable, unlimited broadband in Belize with your prepaid or postpaid mobile plan or Netflix. You can bundle your broadband with your prepaid and enjoy 50% off all national calls, plus get SMS and data. Paid plans? Then bundle with any speed and pay only $25 extra monthly to enjoy unlimited smart-to-smart calls, plus 500 minutes, plus 6,300 megabytes of data. Stream unlimited HD movies and TV shows with our broadband, plus the Netflix add-on for only $30 monthly, and enjoy streaming on your laptop, TV, phone, or tablet. Visit a smart showroom near you to sign up or upgrade to the bundle that's right for you. Smart, bringing people together.
Feels like forever you've been burning for me. I'm here now. Oh, it's a fire indeed. 'Cause I'm oh baby, skin soft like thick like this, wet lips drip drip like this. If you come a little closer, you will see that baby I'm bad.
All right, and we're back. As we promised, we have with us representatives from Galen. Joining us via Zoom, we have the Dean of Faculty of Arts, Science, and Technology, Sherry Gibbs. And we also have with us Research Director and Chair of Development Studies, Dr. Filiberto Pinados. Good morning to both of you.
Good morning.
All right, so let's jump right into the conversation. I know that there's a lot of Galen students as well as those who may not be at Galen as yet but are interested in a master's program that wants to hear what's happening at Galen as it relates to this Master's in Development Studies program. So let's start there. I guess we'll hand it over to Ms. Sherry at first to speak to us about this program.
Thanks so much, and it's a real pleasure being back on here to talk to everybody out there about this program that we're really excited about. So it's been a while in the making, and especially those who've been applying, they've been patient with us because we really want to make sure that this is a solid, really good program for them to be getting into that is really going to address a lot of the issues that we're seeing around as of late, especially really as of late. We've been having conversations just over the past couple of weeks about how important and relevant this program is. And so being a Master of Science and Development Studies, really looking at it being an applied program to address what's been happening in and around Belize and the region. So we're really a shout out to our recent graduates in any of the, social sciences, but even businesses, because one of the really interesting things I think about this program that I've been learning more and more is the importance of entrepreneurship and that entrepreneurial spirit and drive that's really, I think, going to make this program unique. And so, not to scare off anybody who doesn't have any background in business or entrepreneurialism, or doesn't even have an intention of starting their own business, but understanding and recognizing the importance of having that passion, and recognizing its importance. And so that's going to be a really kind of neat little aspect to this program. And so, sorry, go ahead.
No, I was going to say, I think it also allows for the students that enroll to understand that while you may be pursuing one of the social sciences, you still have to figure out ways that do funding, whether it's for research or implementing a program.
Yeah, absolutely. And that's going to be an element of it too. So looking at, and I'll let Filiberto get into that aspect a little bit more. But just what we're interested in drawing in students from various backgrounds. So it doesn't really matter what area you've been in, whether I was mentioning the social sciences or businesses. If you're interested in development and seeing the betterment of your communities and your country, then I think this is going to be a really fantastic program for you.
Yeah. Dr. Pinedas, tell us about your involvement and just how excited you are to kind of get this rolling.
Thank you very much, and good morning to everyone. Yeah, this is a very exciting moment, I think, at Galen in terms of starting this Masters of Science in Development Studies. Sustainable development is at the heart of what Galen does. It's in its mission statement, and I think from the very beginning, from the inception, sustainable development has been essential to the spirit and mission of Galen. So in a way, it is part of Galen's response to ultimately achieving equitable and sustainable development in Belize, and the region really. And what I often repeat, the challenge of rethinking and recrafting, our relationship with the environment and with each other. I mean, it's so much in our minds right now, recently coming out of COP21, the challenges that climate change present, the challenges of what is some people refer to as globalized change, whether it is climate, issues of global health, the economy. There are all of these changes that are happening in the world, and they're happening at such speed and with such complexity that it does require that we have, a cadre of people who can, understand the complexity of the local reality in the global context, and who have the boldness, who have the courage and the creativity to imagine new alternatives, and to have the perseverance and the abilities to enact them. And so that's what this master's degree is about. And you're right. I mean, it doesn't matter what field you're coming from. I think whether it's from the business, from a policy, from a social science, we all recognize that we need new solutions to, in sometimes what appear to be as intractable problems. And so that's what this master's is about. So I'm pretty excited. I mean, development has been something, that has been central to the work that I have done. And I think this is a fantastic opportunity to provide a space for, emerging professionals, but also people who are already in the work space, whether it's, government ministries, development agencies, or education institutions, to hone their skills and a space to engage in dialogue with others and leaders in the field.
I'm so glad you said that, because I can imagine people who have already been working in the development sector having an interest in getting the masters here in Belize while they can work. But my question is, in putting together the program, how are you meeting? I mean, you both have had a lot of experience in working with students and working with the communities. How are you catering to today's reality? How does a newly established development studies program allow for that?
Okay, well, let me try to provide some answer to the question. So, I mean, you mentioned earlier, and Sherry mentioned earlier, the idea of entrepreneurship, right? And entrepreneurship is something that usually is thought about as a business kind of concept. Entrepreneurship has become kind of, a buzzword, something that is thrown around. The way that we understand entrepreneurship is really the ability to think creatively about something and being able to mobilize both the intellectual and material resources to respond to them in a kind of new way. And that's at the center of what we are trying to do. Now, development is as a practice, as an enterprise has been ongoing for quite some time, since the very concept, started around the 1950s. And it has evolved. There are different ways of thinking about development. There are lots of critiques about development. And I think in the current context, in order to respond to the current context, we need to understand both the history and the different views about development. It may sound something simple and sometimes very difficult to define the concept of development. So first of all, we want students to have a critical understanding of development and the history of development. Two, we know that in Latin America and the Caribbean that there have been some very interesting proposals about development that have emerged. Very interesting concepts and practices regarding development that have emerged from communities such as indigenous and local communities. That all needs to be part of the conversation. So that's the next element I think that is really important. And then we really want to provide students with some practical skills, if you want. It's not only about theory, but providing with research skills. That's going to be so necessary. Things are changing so fast. You really need to have research skills. It doesn't matter where you work. You need to be up to speed with what's happening. But then we also recognize that, there's very interesting policies that are being developed globally and nationally, and new policies that need to emerge. So we want to provide students with a foundation in policy making. And then community engagement. Again, things have changed significantly in how we engage with communities. There's a lot of local knowledge. There's a lot of knowledge that we sometimes forget to take into consideration because we've been trained at universities. We need to kind of democratize the knowledge space, if you want.
Yeah.
And that's another of the things that we really want to emphasize in what we're doing. But ultimately, we think that the people emerging out of this program, we want to create a space for them to become kind of innovative and transformative actors.
Who is this program for? What's their target?
Well, as we mentioned earlier, both students who recently graduated, but also people who are working. So if you think maybe perhaps like, where might these people end up? Okay, our aim is to really prepare students who are going to be able to, or are working already in local, regional, international NGOs, that are tackling development challenges. This would be perfect kind of endpoints, jobs for graduates of this program, or people who are already in this kind of situations who want to improve their skills and develop more competitive, more effective skills. This would be a good program for them. People who are in ministries, government ministries, or are thinking of working in government ministries and departments, especially in the areas of research, policy formulation, community engagement, community development. Those we think are two important areas. But also, even, for example, if people who are in the business field, okay, and who want to blend their kind of, their expertise, their business spirit with development studies. I think this would be really good because it allows you to understand the challenges and be able to respond from a business standpoint, to the challenges that we're facing.
Yeah. So the program launches when?
January 10th. Yeah, sorry.
Go ahead.
Yeah, that'll be the first week of classes. So coming up soon.
So people can enroll now. Let's talk about how affordable it is.
Yeah, so when it comes to affordability, I think what we've done with this program, and all of the programs at Galen, is to ensure accessibility.
Yeah.
And so we have currently a reduced rate in tuition. So it's, I think, double check. I think the tuition, so it's 20% off of the normal tuition rate. And so, I think this is a great opportunity for people who are considering this to jump in right now. And then we also have a lot of our finance team really does a wonderful job with working with students and helping them, recognizing that, times right now aren't, maybe some people think it's not financially ideal to jump into this, but I think this is the perfect time to get in and start, sort of readdressing where you are and where you want to go. And so our finance team, we have a student loan program. We have different payment schedules that you can get on. And we spend time getting to know our students, understanding where they are, what they can afford, and how we can work with them.
Now, just one final question. As we look at the program and the skills that one would be able to acquire if they pursue the Masters in Development Studies, for people who are already working in the development sector, what would you say to them about what would incentivize them to enroll in the program? How will it enhance the work that they're already doing?
Well, and thank you, Marilyn, for the question.
Yeah.
Yes. Well, let's see. Maybe I should mention that the program is 37 credit hours and it can be pursued full-time or part-time, right? So that obviously would allow people who are working to pursue this program. One unique element of this program is that, as I said, so it has an applied component. And so there are courses that look at policy development, development planning and community engagement, and social and economic entrepreneurship.
Yeah.
And this, as I said, are applied courses that allow the students to, to begin to apply the skills directly. And there's a capstone project, which is completed over the course of a semester and a half. And this capstone project really allows the student to take on either a policy, a project, or a research project, or a development or research project, and complete it over that. So, but that can be completed within the workspace. So it could be also an opportunity for taking one of those challenges that, whether it's my business, whether it is my department, whether it's my NGO that is contending with, and using this master's to come up with some innovative solution and really have not only the support from the faculty at Galen as you do this, but the support and the input from that network of students that are going to be part of this program. So I think this allows you to actually respond to some concrete challenge that you are facing in the workplace.
I just want to say that I think the rooster thinks you haven't woke up yet because it's very insistent for that wake up call. I love it.
Christmas is coming.
Yeah.
Allow me, if you may, just ask one final question. I know that Ms. Gibbs, you said that it took some time to put this program together, to fine-tune it, to get it to where you want it to be. How does it feel now finally being able to introduce this program to the world and to roll it out?
Yeah, it's fantastic. When I think of where we were at our initial discussions and to where we are now, I think it was definitely worth the wait. And we had a lot of people involved in the process when we were going through. We're doing we have a quality assurance director, Dr. Angel Cal, who kind of walked us through the whole process to ensure that we have that element in there. And so, we had a large committee, we had a lot of people involved in discussing, thinking about where we were going to go with this program. So I think the end product and what we have is like I mentioned earlier, really solid and exciting. I love just what Filiberto was saying too. We were ensuring that it's not just for recent graduates from an undergrad, but those who are working. I think a lot of people who are working want to go back to school. And so working with those people that are in various positions already, whether it's like an NGO or whether it's a government ministry, and recognizing maybe that there are challenges within, or maybe not even having that tool set that you really need to tackle some of these issues, and to be able to do that within this program, and to upskill yourself, but also your organization and what you're able to do, I think is what really, for me, would make this really attractive.
Yeah. Well, and I also imagine in conversation with the students or within the classes, having that Belizean-rooted experience being the focus of conversation, rather than trying to explain the dynamics of the country as you engage in conversation. It's understood as well.
Yeah, I think so too. And so that's why, when we're looking at other programs around the world that, are available for anybody to go to, but the fact that this is really a homegrown project, and really being able to get in and tackle what's going on, instead of just kind of being superficial, at the surface, allowing people to really jump in there. I think that's another really important element.
Nice. All right, and let's talk about deadline for application.
Yeah, ideally, we'd love to get those applications in really soon, before the 1st of December. I know that's coming up soon. But, I also recognize, too, that it's not an easy decision, and that there are a number of things that have to get put into place, whether it's finances, making sure that you have the time, getting everybody on board, your employer, your family, and just, mentally getting prepared for this. And so, we're willing to work with students up until our semester finishes and we close for the Christmas break.
I think you mentioned it's hybrid.
Well, ideally, we'd like to be able to have it online and then be able to meet with students on a Saturday. But again, also working with the flexibility of students, depending on where they are and what they're doing. Because as we were developing this program, we recognize that some of these conversations would just be really great to have in person. Even though I think we've gotten really used to being online and having these Zoom meetings. But I think, just having some seminars where you're able to all sit around, see each other, have those little sidebar conversations with each other. And so, depending on how things go moving forward with protocols and regulations, we would like to be able to have the occasional meeting with students. But we're
tentatively
online.
Hybrid.
Yeah.
Well, that's just the times that we're in. Right. So once again, as you said, the first semester starts in January of 2022, and students can apply online. And is there limited space available?
Yes, but we're also, submit your application and get it in as soon as possible.
All right.
All right. So, we want to thank you both for joining us and for having this conversation with us. We look forward to a later discussion where we talk about, how enrollment has been going and how the program has been transforming lives. So thank you both for talking with us this morning.
Thank you.
Excellent. Thanks so much.
All right. So with that, we'll take our third break. And when we come back, we'll be discussing all things insurance and awareness. So stay tuned. We'll have that discussion when we return.
How can we support the emotional well-being of older adults during COVID-19? During the COVID-19 pandemic, and particularly while in quarantine, individuals, including older adults, may become more anxious, angry, stressed, agitated, or withdrawn, especially those who need healthcare assistance or have cognitive decline or dementia. Here are 4 strategies that can help you in supporting an older adult during this difficult time. 1. Communicate information and listen. present with accurate, simple, and accessible information and facts about the COVID-19 outbreak, its progression, treatment, and effective strategies to prevent infection. Listen patiently to their needs and concerns. For older people with mild cognitive impairment or early stages of dementia, inform them of what is happening within their capacity and provide support to ease their anxiety and stress. 2. Promote positive mental and emotional health. Provide access to available mental health and psychosocial support services, also known as MHPSS services, for older adults and communicate when and how they can access them. Help older people keep regular routines and schedules as much as possible. You can also help them create new ones, including regular exercising, cleaning, daily chores, singing, painting, or other activities. Facilitate regular communication between older adults and their friends and families. 3. Help with medical needs. Make sure that older adults have at least up to 1 month of all the regular medicines that they may require. Explain how to use protective devices in a clear, concise way. Always be respectful and patient. 4. Assist with daily activities. Provide older people with details related to how and where they can get practical help if needed, like calling a taxi, dropping off supplies, having groceries delivered, and requesting medical care, as well as information on any locally available social support programs and services. For more information, consult the webpage of the Pan American Health Organization, www.paho.org/coronavirus.
I am Glenda Brown, and I lost my husband, Henry Brown Sr., to COVID. He was a pastor, and he loved the Lord. He got saved at age 16, and he did his best to walk with the Lord. When he was admitted, I said, well, it's good. He needed oxygen, and that is going to move up, and then, he's going to be back. But it didn't happen that way. Eventually, he got intubated and sedated, and that was the part when we realized, it is getting real worse. We don't know what is happening. We prayed with him, we spoke encouraging words, but we weren't getting response. We hope he heard, but I don't know. I eventually reached hospital unplanned. I spent an overnight in there Monday. That night, because I was tested positive, the doctor allowed me to go and see Henry. And so it was so good to be able to go to his ward. I get to rub his head. But he was saying he didn't think Henry was going to make it. There were much prayers going out on his behalf. But I knew God's will was what was going to be done. I think for me that did a lot. Even now, to could remember that I was able to, touch him and see him those last moments, just the day before he passed. I just thank God for that opportunity. COVID is terrible once it comes to your home. It's something else because you have to quarantine. It's painful. All of a sudden, the connection within the family break down. When Henry passed, the children came and they came to my room. I have windows on both sides of the house, and so that was how we communicated. We spoke from there. Even the funeral arrangement and all these things had to be done. And I went out there to see the vehicle pass. I didn't know they would stop, but I'm glad they did. And so I made my way to the street side. I had COVID, so I knew I had to keep a certain distance from other people to look at that casket in that vehicle and know that Henry is in there. I watched online. It was so hard. I mean, this is Henry. He's gone. He's not going to be back again. Henry hadn't been vaccinated. He didn't want to be vaccinated. I was told that he said to someone in the hospital while he was there that if he gets out or when he gets out, he was going to get vaccinated. I know it's not the only prevention. Washing your hands, doing the other thing, taking your meds does help. So there's a number of things to do, and I encourage people to do all of them. God does protect us, but we are also not to put God to the test. And so I encourage people to do what needs to be done. There's a lot of things I missed him, just not having him coming home again. It's a journey ahead that I am trusting God to take me through. I know He will.
With eCash, bill payment is extremely convenient, and all utility companies accept eCash payments. What's even better? You get to split bills with your roommates, siblings, or whoever you desire. Simply open your eCash app, go to Bill Pay, tap the respective utility company, enter the information, and pay the bill. Then tap the transaction made. Tap Split the bill. Select Evenly. Send the request to who you are splitting the bill with, and get notified when they pay. Talk about making life easy and avoiding confusion. You can split the bill for restaurants, grocery stores, and for any eCash payment you make. To find your next yummy meal, hair treatment, or chill spot, simply open the app and utilize the geolocation service to see nearby businesses that accept eCash. Geolocation and bill payment make life a whole lot easier.
As one of the largest cable and internet providers in Belize, CBC strives to provide our customers with the highest standards of quality, value, and service in all aspects of cable TV and internet. Monitoring our systems closely, our technicians combine creative planning and state-of-the-art technology with years of experience and training to develop and provide the most reliable and advanced cable and internet service to exceed your expectations. For CBC and our team of talented engineers, technicians, and customer service representatives, delivering less than the very best is never an option.
We're back and we're moving into our final conversation for today, where we get to find out more about the activities taking place in Insurance Awareness Week and a very important fundraiser for the Kidney Association of Belize. We have with us on set Ana Cortez, who is the administrator at the Kidney Association of Belize, and we have Carol Panton Rose, who is the president of Bellifa. Yeah. Good morning.
Good morning. Good morning.
And thank you all for being here. I've been joking since the start of the show of how you can make the Red Gala virtual, but clearly that's not going to be possible.
Not in these times, Marlene. Yeah. We were talking about it, I was just mentioning it to Miss Anna, and she was saying, you know, how she missed those times, yeah, and how hopefully maybe something could happen next year. So. Yeah. Yeah, and so my association and Miss Anna's Kidney Association and the Belize Association of Insurance and Financial Advisors have been known to work together.
Yes.
You know, we're here together because we have a relationship that is more than 10 years old. And so every year, you know, we come together to do the Red Gala. That's like our biggest fundraiser in support of people who are suffering kidney failure. Yeah. And most importantly, we have been known to have a health fair where people come and they do free testing, urinalysis, sugar levels, kidney function, and you know, that has been a great help in terms of awareness and detection in the past. So we do share a strong relationship, and so we're here together today.
Yeah, and that's like an important part of the conversation, because as you talk about insurance, it's interesting that Bellifa has partnered with agencies like Kidney Association and Diabetes Association. The assumption is that clearly the majority of the work that you do is geared in this direction.
Well, for people who may not know exactly who we are, maybe I could tell you a little bit more about that.
Yeah.
So we are an association of insurance advisors, you know, individual persons like myself, and we are from different insurance companies in Belize. So we're from 4 insurance companies. We have Sagicor Life Inc., RF&G Life Insurance Company, Diversified Life Solution Brokers, and Atlantic Insurance. So we also have our parent company, who is the Caribbean Association of Insurance and Financial Advisors, who is really the education provider for our advisors, so that, you know, when we meet and interact with people and build relationships, we're able to give good advice. And so even our parent company has taken on the kidney cause. You know, they have a whole foundation dedicated to wellness and the kidney cause. And so, you know, I won't touch on that too much. I'll let Miss Anna do her thing when it comes to that. But I mean, we all know that things like diabetes and things like hypertension and not getting enough water intake, those things eventually lead to kidney failure. And all around the world, not only Belize, it's more than half of the population is affected. In doing our insurance work, talking to people about finances and their health, you find out that like every other person in a household is affected with hypertension and diabetes. Yeah. And so these things are very much intertwined in what we do.
Before we go to Miss Anna, I have to ask, what we're talking about insurance awareness. Why should people become more aware about insurance? For a young person like myself, for example, who may just be seeking to test the waters as it relates to insurance. I know my mother, for example, she had perhaps is signed on to a couple insurance plans, and she's been telling me, Paul, you need to figure out your insurance stuff. Like, why am I not sick? I healthy, I do work, I do make money, I save, and I feel like I need insurance.
Right. Perfect question. We get it every day. I mean, so what we do, we offer the life insurance, we offer the health insurance, and we offer retirement planning, right? And in so doing, it is actually at this youthful stage in your life that you need to set a foundation. You understand? And when you talk about sickness and death, it's an uncomfortable situation. I know they look for going away anytime soon. It's not my wish. You know, but at the end of the day, these are the realities that we face. They are things that are inevitable. I mean, even if you're a person that lives more on the healthy side, you find out that these things just spring up. We're affected by cancer, heart disease, diabetes. These are the things that are affecting the young or the old, right? The young and the old. The age has nothing to do with it. So as young people, we have a lot of young people who are very focused, but it's a time in your life where maybe you're not thinking about the long term. You know, yes, you are fairly healthy, but you never know what could happen in life. And it's better to start planning for your health and your finances at a younger stage in life, because you don't have the big bills, you don't have that mortgage that you're paying, you don't have the responsibilities that we get into as we grow older in life. And, you know, it's all about the youth. If we're to change the situation just within our country, it have to start with the youth. Like simple things like savings. When you look at a younger person, maybe perhaps getting their first job, right? They would be into things like maybe getting a fancy cell phone, where it costs 1,000, 2,000, and sometimes more than that.
A nice car.
A nice car, maybe getting a loan for the nice car. So we have to be there as parents and as advisors to say to you, no, you don't have to do it that way. You don't have to get caught up with the hand to mouth that we hear about, because it seems that it doesn't matter how much you're making. You could be making low, middle, a higher income, but you get caught up in the financial struggles because you never did it properly from the beginning. So you need to think about it. You're at this stage where you need to think about it the most.
And I think you highlighted something there just in your answer that shows kind of the evolution of persons who work in insurance, that it's not just about getting someone signed on to a policy. You advise people about how their finances are being used and offer products that can help them to set themselves on the right track. Have you seen a change in the uptake of persons signing on?
You know, surprising, at the beginning of the pandemic, it was tough. There was panic. People were losing employment. People are still losing employment. And I mean, at the end of the day, to do something for yourself, you have to have the finance to be able to do that. And so it was a rough time for us as well, because it talks about affecting our sales, you know. But at the end of the day, the need is there even more so, because people have always been dying. People have always been getting sick. But now COVID is just another reason why, you should be vigilant. And so when we sit with persons now, we find out that there's more of a calm. I mean, the pandemic is still on us, but people are realizing it's in these trying times that you need to try plan. I mean, think about somebody that is a breadwinner, and you may sit and think to yourself, you know what, I have my wife at home, she's a housewife, I have young children, I provide. What happens if I'm not on the wake-up list tomorrow? Doesn't have to be COVID. A lot of things are happening exactly, even the accident rate. It's not promised that we're going to get home tomorrow. As a matter of fact, it's not promised that we'll leave here today. We don't have a moment promised to us. So people are more receptive, just to answer your question. And so we have to work with them to ensure that, like I said, we give the right advice. We look at their finances and help them to see areas where they could make that room in their budget to try to do something for themselves in terms of protection.
All right. And when you talk about sickness and some of the costly illnesses that you may have, chronic kidney disease, definitely one high on the list. Hannah, let's talk about what's happening in Belize when it comes to whether people are taking care of the kidneys.
Yeah, well, because of the pandemic, the association has been not doing their educational awareness campaign that we normally do every year. We found out that more patients were suffering. I mean, we have been getting calls every week of people that is suffering from renal failure, newly diagnosed patients that need assistance. And we as the association need to find the funds to assist them, right? And that's where the fundraising events come from. And it's been challenging since last year. We haven't had any fundraisings until this year when we had the telethon, which we are doing the final call.
Yes.
We are doing the final call this month. It will end the 30th of November. But with that said, I mean, the amount of patients suffering and that are in need of assistance is a huge number.
Before you go into the fundraising, I don't know. So how costly is it, the treatment?
The treatment itself. Remember that a patient that is diagnosed with renal failure needs to do 3 dialysis treatments per week. And each dialysis costs roughly about $200. So we are talking about $600 per week.
Wow.
So per month.
Stay alive.
To stay alive, and that will be for the rest of your life.
Wow.
And that is $2,400 per month.
Per month.
Plus medications that the patient might need.
Yeah. And we're talking about people that are employed that may not be able to work because of their condition.
We have some patients that are still working, but bear in mind that as the disease prolongs, they might not be able to work any longer. So, and we are talking about breadwinners, of the family. So that's where the stressful issue comes from, because then the family, probably the father or the mother is the one who has been diagnosed with renal failure. They were the ones working, and they cannot no longer work. And remember, I mean, at the amount the amount that they will be paying for the dialysis, then they won't be able to pay for their
basic
utilities.
needs,
Exactly. Their food, whatever else they need to pay.
And the situation worsens because of the conditions that are most prevalent in our country. So let's talk about how someone gets to the point of renal failure.
Because it happens because two of the main leading causes for renal failure is diabetes and hypertension. So we also recommend whenever we do our awareness, we recommend that people see their doctors every month. Or if you are not suffering from any of the illnesses, then we recommend that you have a regular checkup every year.
Yeah.
Just to follow up on your condition. I mean, it doesn't have to be that you are suffering from anything, but you just want to know what's happening in your body.
Yeah.
Yeah.
How easy is it to know how healthy my kidney is? What kind of test do I have to take?
You do a kidney function test, and it's not costly. You do a creatinine and bone test. You go to any of the labs, and it's about $20. So $20 would tell you, okay, your kidney, you need to start drinking more water. You need to watch what you're eating. You know, I mean, it's a diet. That's what you have to follow. A diet plus drinking a lot of water.
I mean, $2,400 a month. That's more than a basic salary.
Right.
Yeah, I think a basic salary runs somewhere around $1,500 or so. So I mean, that's a lot.
That's a lot.
It is a lot.
So we compare the $20 that you would be spending to do your annual test to $2,400 a month that you will be spending for your treatment. It's a lot.
So how many patients does the association see?
Normally for between the year 2019 to right now, we have assisted 165 patients.
Wow. And for a wide range of assistance, or basically financial assistance?
No, it's financial assistance in terms of their dialysis. And then we have other members that would call for assistance for medications, to do some lab tests. You know, there are some lab tests that would cost them more than $100, so they would ask for assistance. But roughly, that's what we normally assist them with.
I think to put things into perspective, these are persons really asking for help to preserve their lives.
Right.
These are persons asking for help to live.
To live.
We want to live, and we don't have the finances. We don't have the means per se or access to it fully, and so we're relying on the Kidney Association to help us to live. How do you deal with that burden? How do you?
It's very difficult. It's been challenging, especially this year since COVID. We have had many deaths. Some because patients were not able to come and receive their dialysis. Some because they did not have the funds to do the dialysis, and others with just complications. So if the person pass a week or two without doing the dialysis, then it really tells in his health condition. So it's not recommended that they skip dialysis, and that's where the assistance come from. Whenever we do fundraisings, that's what we use the funds for. But it's been challenging on my personal perspective. It's been challenging.
Yeah, of course, because I'm sure you want to help everybody.
I would want to give them my salary to assist them, but I have my own bills. But it's I would want to assist on every person that calls. It's I receive 2-3 calls per week, and it's like, how do I tell them we are low on funds? How do I tell them I will put them on a waiting list?
Do you have donors you can call? Like if somebody knows, okay, Miss Anna, if you're running into a bind and somebody needs a dialysis treatment, you can call me, or?
No, not like that.
Okay.
I wish I would have people that would call me and tell me, hey, if you need any assistance, you are free to call me anytime. No. We are basically, waiting on assistance from the bigger community, from the business community.
And all that you've said underscore the next point, which is the telethon was held earlier this year, and this is your public reminder to be able to submit those donations. How do people submit them?
We have the flyer. The flyer is on the Facebook pages of the 3 associations. The LIFA, the Diabetes Association, and the Kidney, because remember we partnered with Diabetes Association as well.
Yes.
So we have 3 of our account numbers, and the Kidney Association account is Atlantic Bank, right, Ms. Anna? The Diabetes Association account is Belize Bank, and the LIFA's account is Belize Bank Corp. So it's all on our Facebook pages. We even have a GoFundMe account, so even our colleagues in the diaspora, wherever you are. So, that is how you can reach out. And of course, you could get in contact with any of the organizations, the associations, and we are ready and willing to
Even if you missed the telethon, if you're listening in now and you realize this is something you want to support, they can go to the GoFundMe page, or there are the bank account numbers, and people can make that transfer.
Right, right.
Go ahead.
No, I was just going to say, and that is an important part of our Insurance Awareness Week, because we are soliciting, we're still, as we speak, soliciting businesses.
Nice.
So we're just soliciting just about any business we can think about that we know have supported in the past, and that we think we stand a chance to get a contribution.
Yeah, I know you said that it's been a decade of partnership, but I still have to ask, how did Belaifa come to realize this partnership? Speak a bit about that, if you would.
So remember, like I said, even our parent company, it was from the very inception of our association that the kidney awareness was there. And so, it is something that is, embedded in just the parent association. And then at the end of the day, of course, relationships get personal because we have friends, and we have people who are going through these things. I mean, you can think about just your family members, just friends and colleagues, it's all around. And so it was really and truly through personal relationships. I think Miss Ruby Nicholas was one of the first persons to get involved with Belaifa, and so, it was just personal connections. And ever since, we've been assisting the Kidney Association because the need is just so grave.
Yeah, I asked that because insurance personnel oftentimes gets this bad rap that you want the healthy people, you want to speak to those who are healthy, and you may want to avoid those who are sick or severely ill because they don't benefit what you're selling the most. And so to see something like this, it definitely shifts that perspective.
Well, just to make a comment about that. So we are operating under the theme, Enriching Lives Through Financial Freedom, Insurance, a Business of Caring, right? So we're not only here to look out for the healthy people and to collect those premiums, right? Yeah. But at the end of the day, we have to care because it's about awareness. When we sit with you, even if a person is not in a position right now to take out an insurance plan, there is something that we have identified. Look at the way you're spending your money. What are you doing? And you pick up the habits that we all have. This life has become so demanding that just eating habits, you don't find that people are cooking a lot. They are eating out. And when you look at the budget, food is one of the biggest expenses. Right. So we are able to sit with people because it's not all the time that people even run a budget. So, the process that we take you through before we actually recommend an insurance product speaks to wellness, speaks to what you're doing with your finances, speaks to your whole foundation. So we have to care. It is a business of caring. And so that's really the foundation of it. And so getting people, we're a business. Yes, we're here to do business. We have to get people on the books. But at the end of the day, we're helping people to make better lives for themselves. And moreover, be able to provide if you're not here. If you get sick, thinking of having a mortgage, the average person has a mortgage. What happens if you get a critical illness? How is that mortgage going to be paid off? Did you know that there was something through insurance that you could put in place? Yeah. That you can take advantage of?
Or saving for retirement if you don't have a retirement plan. We
is
can go on. We're going to do a separate show about what all you can do.
Yeah.
But I do want to get in the point, I think you both have highlighted how great a need there is for persons who are simply trying to stay alive if they have some form of kidney disease. And so those donations can be funneled to the organizations. And also you have a food drive happening?
Yes, that's the other big event happening. Every year we solicit food items for the Liberty Children's Home in Ladyville. So another goal of ours is that we want to extend our reach, right? So this year, and we are soliciting for our food drive as well. But the biggest part of it is that we have our advisors who will be stationed at 3 different grocery stores. So we have Publix, who always supports us, and Brody's as well. So it's going to be Publix on the highway, Brody's on the highway and downtown. And you literally see us there soliciting grocery items. So you all feel free to stop by. It's going to be Friday and Saturday, right? And so we want to donate to the children's home. We also have agents in the districts as well, advisors in the districts. And so we're going to be helping Marla's House of Hope in Belmopan and the Cornerstone Foundation in San Ignacio. And so we also want to be able to touch individual families with food hampers. So the food drive is a big thing for us. We want to be able to help more people. And so we are really looking to see how we can capitalize on that.
So that's Friday and Saturday, in front of the two Brodies on the highway downtown and Publix on the highway. Persons going to shop can go in, pick up a couple items. Are we talking canned items?
Food items.
Okay, so whatever food items, go in, pick it up, come back outside and give it.
Right, definitely so.
Can we just go over briefly how persons can donate to the drive for the association?
They can donate. We have our Atlantic Bank account, and you can find it in our Facebook pages, as Ms. Panton mentioned. It's on our kidney Facebook page, diabetes, and Belife have the Facebook page. But our account number is Kidney Association of Belize, Atlantic Bank, account number 100321028, or you could also call me at 615-6861, and I will be more than happy to answer your calls and direct you how to deposit your money.
Nice. All right. Well, ladies, thank you so much for coming in and reminding us of the need that exists and how we can show our support. We wish you the best of luck, and definitely going to tell people that when they see the insurance agents this weekend to be extra generous. You could fill an extra basket for them.
Yes.
All right. Thank you so much, and
Thank
stay
you
safe.
so much. We really appreciate it.
All right.
Thank you.
Right. So with that, we'll take our final break, and when we come back, we'll wrap up our Tuesday morning conversations.
If you are ailing due to a chronic disease and are left permanently invalid before retirement age, you may want to check if you qualify to receive invalidity benefit. The invalidity benefit exists for persons who are unable to continue working due to permanent illness. To qualify, you must be under 60 years old, must be sick for 26 consecutive weeks and certified to be medically unable to perform any type of work, must have at least 5 years of paid SSB contributions and at least 5 paid within the 3 months leading up to your illness. If you do not qualify for the invalidity pension, you may be eligible for the invalidity grant. Want to know more about invalidity benefit? Visit our website or contact any of our offices to have someone assist you. Also, be sure to visit our Facebook page and give us a like to stay informed. Social Security Board. Safeguarding you, your family, your future.
It's almost lunchtime and Alice is getting hungry and forgot to bring cash. She remembers that eCash now has a geolocation feature in which she can easily view the eCash merchants near her, especially restaurants. Her co-workers also ask her to order food for them.
Chicken chow mein, please, and a Coke.
The merchant sends her the payment link. She taps confirm, and within a few minutes, her food is delivered. Alice then views her transaction history and taps on the transaction recently made. Then taps the split the bill button where she selects the unevenly option and moves the bar to the desired amount per person. The request is then sent to her friends. Her colleagues accept the request and are ready to enjoy their meals. Geolocation and splitting the bill via eCash make Alice's life a whole lot easier.
It's a fact that your credit lasts longer when using Smart. During these times, we're all trying to find ways to cut costs and save the little resources we have. With Smart, it's easy to do that. It's a fact that with Smart, your credit lasts longer. You can call Smart to Smart and Smart to Digi using your promo credit, while with the other guy, you can only call OnNet, Digi, or BTL numbers. What does this mean? You get to call any national number using your promo credit. Your promo credit is free, so that call is also free. Know your facts. Don't be tricked by the other guy. Be smart and save your dollars.
We're back.
That's the wrap up of 3 conversations.
Very diverse conversations.
Yeah.
We want to say thank you to all our guests who came in today.
Yeah. Well, we want to thank, first of all, the folks over there at National Women's Commission and the Spotlight Initiative. We want to commend them for the work that they're doing. We know it's such a hard task in this day and age to bring awareness to this issue as it unfolds in our lives, in the media, and across the country on a weekly basis. So they definitely have their work cut out for them. And as a nation, as communities, we have our work cut out for us as well.
We also want to say thank you to Galen University for telling us all the details about their new Masters in Development Studies that they will start. They're currently accepting applications for, and the program starts in January.
And finally, we want to thank the folks from Bellifa and Kidney Association of Belize. Be sure to support their initiative, find out, reach out to them and find out more about how you can help. We learned a lot about what Bellifa is doing in partnership with the Kidney Association, and off camera, I learned more about why I should be signing up for or seeking insurance for my own life. And so those were some interesting discussions.
All right. Well, with that, though, we got to wrap up the show. If you'd like to contact us, send us an email at oye@channel5belize.com. You can find us on Facebook.
Find us on Facebook at Open Your Eyes BZ.
And you can also find us on Instagram at OYEBelize. Remember to tune in tomorrow morning at 6:30 when you open your eyes.
And start your morning right.
Until then, keep your eyes, your mind,
and your hearts.
Have a great day. Stay safe, Belize.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.